And And then when he goes back to the podium, then everybody will just go back to their seats. You don't have to stay around.
Good morning. Good afternoon. Thank you. Oh, sit down, please. Well, it's great to be back in Southwest Florida. We're here. We got some good bills that we're going to be able to sign, and I know this has been something that our outgoing Senate President Pasadomo's worked very hard on. So today she gets to see it come to fruition, which is great, and she's here with us today. We also have our APD Director, Taylor Hatch, with us. We have the President and CEO of Tampa General Hospital, John Corus, and we have our State Surgeon General, Dr. Joseph Ladapo, with us to offer remarks about the legislation. You know how the one thing you can tell if you're doing a good job is, people do hit pieces on you. So they're after Ladapo again for just basically speaking the truth and not towing the company line on a lot of the stuff. And look, we've seen over the last 4 years just some of the entrenched medical establishment, how wrong they were about a lot of things that are very important. And I think we have somebody like Joe that's going to call it as he sees it is really, really important. If they're telling you that somehow, putting a piece of cloth over your face is going to save you from a respiratory virus, they're lying to you. And he's been willing to say that. Not a lot of people are. If they tell you that mRNA shots will prevent you from acquiring COVID, they are lying to you. That's not true. And so he's been somebody, when they tell you that you need to close schools to stop a respiratory virus, that's also false. So he has been willing to speak out against that, but what happens is people try to take pot shots. And so all I know is if they're attacking him, he must be doing a good job and must be over the target. So thank you for that. We're also joined by a number of additional legislators. We have Senators Harrell, Burton, and Martin are joining us, as well as Representatives Botana, Grant, and Rommel. So you guys all thank you. Did I get everybody? Esposito? Oh, okay, good. Yes, that's so thank you for coming. So we're today going to sign a number of bills related to health care. Kathleen and some of the other speakers will probably go into more detail than I will. But I think if you've looked, we've done a lot in Florida to really lead on this issue. Of course, during COVID, we led against the grain. Now everyone says, they act like, they all said schools should be open. They were not saying that at the time. Trust me, I remember. I was there. They were not saying businesses should be open, all that. But bottom line is we really led. But we also led on empowering people. When we started to see the movement to mandate people take mRNA COVID jabs, we called a special session of the Florida legislature and said, no, that's your choice. People shouldn't be able to force you to choose between a jab and a job. And so we protected the jobs of tens of thousands of people in the state by doing that, and we were the first ones to do that. We've also understood the need to cut back against some of the medical industrial complex that's made so much of our medical pharmaceutical pharmaceuticals as well as medical services so expensive. So we've done things like bring transparency and accountability to the pharmacy middlemen, the pharmacy benefit managers. That not only helps reduce costs for consumers, it also helps our family pharmacies, which is something that I think is important. We don't want just 2 or 3 conglomerates to be controlling all the pharmacies in this country. And so so that was really, really good for doing that in the state of Florida. We've also done things like expand telehealth, something that is could potentially be more cost effective. We've done a lot of things. We did shared savings for our state employees. You know, you talk about nobody knows how much any of this stuff costs. We have a legislation in Florida that has prices that are published, but you also need to have an incentive to shop. And so in our state health plans, if you choose something, a procedure, and you can get it cheaper in one place versus the other, you actually get some of that savings through reduced premiums. And so we've seen millions of dollars saved for people in our state health plan because of doing that. So that's been very innovative. We've also leaned in through the leadership of our First Lady and my wife, Casey, really leaning in on cancer, not just supporting research, but really supporting innovation and wanting to see really, really big things done. So yes, it's been money, but it's also been, I think, a regulatory framework where we want people to really think big and think outside the box. And so that's been very, very exciting. So that we've done it. And we've recognized, and COVID showed this, we've recognized the need to have a really good healthcare workforce. We started by putting a lot into expanding nursing training in the state of Florida. So you have way more resources than you did 4 or 5 years ago. Part of that is to keep up with the growth, but also just understanding that that's an issue nationwide, even in states that are not growing, to see nurses, especially as more nurses retire, you need to have more. So we've been really leaning in on that, and we're excited to do that. Now, there's a series of bills that I'm going to sign today, and I think it builds off a lot of the success. I mean, one, Senate Bill 7016, that is going to help us really expand and do what we need to do to have a great healthcare workforce, which is something that's important in a growing state. This is going to be needed. You're talking about underserved areas. You're talking about in low-income areas. You're talking about having more flexibility for healthcare providers to be able to attract graduates from other states to be able to come and serve our residents. And so I think it makes a lot of sense that they're doing that. We're also going to do Senate Bill 718, which I know Kathleen will talk about, but we really want to see innovative strategies. We're putting some money set aside, offering low-interest loans so that we can see and spur innovation in the healthcare space. Senate Bill 1758. This is something, a lot of this had been underway with our APD, Agency for Persons with Disabilities, as well as my wife, our First Lady's initiatives, Hope Florida. So this will codify care navigation services provided to clients and their caregivers to help address both immediate and long-term needs, and it expands access to home and community-based services by appropriating more than $38 million to serve those in pre-enrollment categories. So I think that's going to be something that's going to continue to make a difference. We also have a bill that is going to help with behavioral health, and I know John Corus will talk about it, Kathleen will talk about it, but you know, you see some of these things. Sometimes these people will do horrible things throughout our country. You know, it used to be that some people would be in an institutional setting because that was the best thing for them and that was the best for the safety of the community. We as a society have walked away from that. And so I've said, look, I want more beds for mental health patients, particularly people that are not able to function in society. And so this is going to be, I think, a key component of that. And I think it's something that's going to be very, very meaningful. So there's a lot that's been done here. There's a lot that we're going to sign into law. And I appreciate the hard work of the legislature, and I know this is something that Kathleen has been working for a long time. So congratulations on getting it across the finish line, and today is the final. So come on up.
First of all, I want to thank Governor DeSantis. He has been an amazing partner to me and my colleagues in the legislature. We've had a great 2-year run. Of course, you're stuck with me for another 2 years. I just won't be president. Today is the culmination of, I think, my career in the legislature, and I am so pleased that the governor thought enough of these bills to come to Southwest Florida, my home, to sign them. A series of 5 bills, the Live Healthy initiative. The broad appeal of the free state of Florida, thank you, Governor DeSantis, continues to attract families, businesses, and seniors. In fact, over the next 5 years, our population will grow by almost 300,000 new residents per year, 800 people per day. That's like adding a city slightly smaller than Orlando, but larger than St. Petersburg every year. Unfortunately, the new Floridians are not bringing their healthcare providers with them. We're going to change that. The good news is that Live Healthy will help grow Florida's healthcare workforce, increase access, incentivize innovation so Floridians can have more options and opportunities to live healthy here in the Sunshine State. The fact is, we need more maternity rooms to welcome new Floridians to the family. We need more services for our elders to live out their golden years safely and with dignity. We need more primary care providers who play a vital role as the main point of contact in the healthcare system for families and seniors. Access to healthcare is important at every phase of life. Insurance, including Medicaid and Medicare, does not guarantee access. Even Floridians with great insurance face barriers to care. Through Live Healthy, Florida will grow the healthcare workforce we need to serve our communities. We are expanding sites for clinical training to include more rural and difficult-to-access locations so sick and injured Floridians do not have to travel long distance for care. We are increasing access to preventative health screenings to ensure early diagnosis and better management of chronic disease. And we are streamlining emergency departments through partnerships with community health centers and other primary care settings so care that is urgently needed but not life-threatening can be handled outside of the hospital emergency room in a more efficient and cost-effective setting. Live Healthy increases workforce mobility and incentivizes Florida-trained healthcare workers to serve in needed fields like mental health, labor and delivery, and helping Floridians with disabilities. We are also increasing access to effective, efficient, and economical health care with an emphasis on connecting Floridians with primary care providers who play a vital role as the main point of contact in the healthcare system for families and seniors. Free market principles show us the private sector can innovate in ways government can never imagine. What government can do is facilitate the exploration and implementation of innovative technologies and delivery models that increase efficiency, reduce strain on the healthcare workforce, improve patient outcomes, expand public access to care, and reduce costs for patients and taxpayers without impacting the quality of patient care. Our Healthcare Innovation Council will convene experts on the delivery of healthcare to examine solutions to improve the delivery and quality of healthcare in our state and develop a loan program to support implementation of innovative solutions. Our behavioral health teaching hospitals, which is so important, and I want to thank Governor DeSantis because it was actually his idea, and I just took it and ran with it. It's going to train the next generation of professionals in innovative and integrated care for those with behavioral health needs. They will provide inpatient and outpatient care and support families who have loved one that cannot return to home, and it is in need of a long-term residential treatment for mental health challenges. Everyone deserves a chance to live healthy, and for our fellow Floridians with disabilities, that means living independently at home in our communities for as long as they possibly can. Caregivers, particularly family members of those with disabilities, are truly amazing people who sacrifice so much. As a caregiver ages, it can be difficult for our neighbors with disabilities to receive care at home, an accelerating need for additional services. The last thing we want is for loving families to be separated. Live Healthy prioritizes home-based care options and associated funding for those with aging caregivers, so both the caregiver and the person with the disability can live a happy, safe, and healthy life in their own home. That's just a quick summary. I could go on and on. I'm really, as I indicated, I am so grateful for Governor DeSantis' support. Also, the senators and House members that worked on the bill. The Speaker, who has become a dear, dear friend, who worked with me side by side on all these initiatives. Senators Burton, who is here, Senator Harrell, Senator Broder, who couldn't make it, Senator Boyd and Collins. They all worked really hard on this initiative. Reps Gossett Seidman and Grant, who are here today. There were so many people who were involved in Live Healthy. I can't even go into it. Let's suffice it to say that this is a game changer. Our state will forever be changed in a really good way. Thank you all. Thank you, Governor.
Taylor? Yeah, we'll do Taylor then Joe.
Good afternoon, everyone. It is so great to be here with you all today in Bonita Springs. I want to first thank the governor for his steadfast leadership and for his continuous support of the developmental disabilities community. My name is Taylor Hatch, and I have the absolute honor of serving as the director for the Agency for Persons with Disabilities, or APD for short. It is a privilege to be here during National Developmental Disabilities Month and on World Down Syndrome Day, alongside the nation's best governor, Governor Ron DeSantis, and our wonderful Senate President, President Pasadomo, and so many senators and representatives, as well as my dear friend and colleague, Surgeon General Ladapo, and outstanding families and partners that are here celebrating the signing of Senate Bill 1758. Whether it's standing up for the rights of Floridians, like Isabella, a Special Olympics athlete, when individual rights were under attack, championing efforts to keep critical money in the pockets of the people we serve by increasing a personal needs allowance, or opening the doors of the governor's mansion to create a memorable atmosphere for guests and their families to prepare for a night to shine. This governor proves time and time again he never backs down from doing what is right, including creating opportunities to empower all Floridians, including those with unique abilities. This legislation is just another example, and it is a tangible reflection of the governor's commitment to the people that we serve. What's incredible about Senate Bill 1758 is that it is a direct result of feedback and influence from the people that we serve all across our great state. It builds on our current foundations and framework and also embraces the need to create multiple pathways to serve the best among us. There are several major components to this bill that fundamentally change the way that we approach our charge. First is the intentional and holistic way that we assist Floridians at the earliest moment possible in navigating services and connections with local community-based supports, such as churches and not-for-profits, to promote community, empowerment, and a goal achievement. The second is to begin the development of an additional pathway which aims to close gaps and preserve high school graduation for the exciting time that it should be for all Floridians that are transitioning into adulthood. Third is to provide the direct connectivity of an eager and skilled workforce to employers and businesses across multiple industries, as we all know the cascading benefits of a job. And finally, through the leadership of our legislative partners, this bill also challenges the status quo by streamlining our processes when someone raises their hand to seek assistance, as well as provides additional funding to meet the needs of the people that we work to serve. By affirming our commitment to those living in our state with developmental disabilities and their families, through APD, we are working to preserve the God-given potential of our fellow Floridians to live, to work, and to thrive in their local communities. Thank you to the many people that are here today. We are so excited to celebrate your hard work. And thank you, President Pasadomo, for being a champion alongside our bill sponsors. And of course, thank you, Governor, for signing these great bills and for your fearless leadership. Thank you.
Good afternoon, everyone. Okay, good afternoon, everyone. I wasn't saying it to elicit a response. The second time, I just this thing wasn't pointing right. Well, I'm happy to be here this afternoon. It's always fun to hang out with the governor and my colleagues, and so that's always a pleasure. And of course, our lawmakers here in Florida care a lot about Floridians, and the team of our lawmakers and the governor and his vision has really changed the way Florida looks over the last few years for the better, and it's also influenced the rest of the country, if not wider than that. And this legislation is a really good example. Obviously, we've heard the enthusiastic description of the legislation's components from our Senate President, and it really is healthcare workforce is a challenge. I mean, it's tough to get appointments oftentimes, especially with specialty physicians. It's tough to get a physical therapy appointment. It's tough to, tough to see a nurse practitioner. So providing more avenues for healthcare workers to be able to get to Floridians is a good thing most of the time. No, I'm kidding. But I'll highlight two parts that are relevant to the Department of Health that I particularly am very happy about. One of those is our telehealth program for moms, and we're expanding this program. Right now it's in a pilot phase in Duval County and in Orange County, and it's a telehealth program for pregnant moms so that they can get things like blood pressure checks, can get things like glucose checks to see if they're developing gestational diabetes, and also, there's a piece for mental health screening and potentially treatment, a route to treatment for postpartum depression, which is a challenge for many women. So we're going to be expanding this to every county in Florida, and I think it's a wonderful thing. There are moms out there who just don't have access to the type of resources to have that type of monitoring and testing done. That's a major problem for a lot of moms, and I think we'll be able to really help fill that gap with the expansion of this maternal telehealth program. The second piece that I want to highlight that's relevant to some of the white coats I see out there and maybe some other people who aren't dressed in their uniforms is the expansion of the FRAME program. So this is a program, it's a loan repayment program. That always gets the attention of graduates of medical schools and nursing programs, especially or dental programs with those six-digit debts that many people graduate with. And this program, again, it's not only for traditional healthcare workers, if you will, in terms of our nurses and our doctors, but it also includes our dentists and our dental hygienists. So it's fairly expansive. And the objective of this program is to help people who are in rural areas where they have even less access to health care than our St. Pete's or our Orlando's or our Miami's, to be able to have more access to health care by attracting or incentivizing healthcare workers to take care of patients in those communities. So I think it's a good program, I think, and we'll monitor it to make sure that it keeps achieving the outcomes that we want in terms of really helping people in underserved areas get access, which can be an enormous challenge for many people. The application deadline for, again, our white coders out there is April 15th. Just April 15th again for anyone who's interested in applying for funds to pay off those sometimes hefty school loans. And then I'll add a last thing, which is that healthcare services and access incredibly important, especially when you need them. But we're in a time where where there are a lot of voices out there that want to convince people that health equals healthcare, and health doesn't equal healthcare. That's been one of the things that have been important to me to communicate over the last few years, that really health starts at home. It starts with the decisions that we make every day in our lives about what we put in our bodies, about what we do with our bodies in terms of exercise or getting to the gym, lifting weights, walking, swimming, running, jogging, walking the dog. And, that's where health starts. And there's a lot that we control in our health. There's other stuff that's harder to control that's in our environment that also affects our health. And in my lifetime, I pray that we'll be able to actually make a much bigger impact on those also. But health starts at home, and I wish you all good health and good choices, as well as we can do, at least, right? So, all right, God bless you guys. All right.
Good afternoon, everyone. My name's John Corus. I'm the president and CEO at Tampa General Hospital. Before I begin my remarks, I'm standing in front of a colleague, Dr. Larry Antonucci, who runs Lee Health, and we're in your community, and I wanted to take a moment and recognize you. Larry's a great guy, great leader, and he runs a world-class health system right here. It's great to have you here. I want to thank Governor Ron DeSantis and President Kathleen Passidomo for their leadership, their innovative spirit, their willingness to partner and collaborate with the industry, not just lawmakers, but the industry itself. I've been doing this a long time, and I will tell you, I can't remember a time where it's been more innovative, more collaborative, and we've had the strong leadership that we have both at the Senate, the governor's office, and on the House side. It's absolutely been wonderful. So thank you very much, because what they're tackling right now are some of the biggest challenges that we face in the Sunshine State, and that's access to health care in a reliable, reproducible, sustainable kind of a way. We're facing a myriad of challenges in the healthcare industry and the healthcare system. There are critical shortages in the healthcare workforce. We've seen an exceptional growth in labor costs. Patients are struggling to access the care they need, and the demand for behavioral health services is at a record high. And one of the most impressive things that I saw from the governor and his wife, our First Lady, and I'm speaking both as an industry leader and as a Floridian, was one of the first things that the governor and the First Lady decided to tackle when he became governor was behavioral health issues. Like one of the most challenging and complex issues, not just in the state, but across our country. That immediately said to me, we have a real leader here to lead the state of Florida, and we have a First Lady who is deeply committed to that. While these challenges are complex, they're not insurmountable. Through innovation, we can transform the delivery of care, increase access of care, and improve patient outcomes. For example, at Tampa General, we've created a hospital-at-home program. It allows us to provide hospital-level care to eligible patients in the comfort of their own homes. It's cut costs and improved patient outcomes, while freeing up space inside the hospital for patients with more critical conditions. Our readmission rate, here's one data point which is really important, because readmissions aren't good for patients, they're not good for health systems, and they're incredibly costly. The average readmission rate in a hospital is anywhere from 14 to 16%. The average readmission rate at a hospital-at-home patient, 4 to 6%. It's a state like Florida that allows us to innovate, create, explore, and try new things so we can improve cost, quality, and pass that value on to the consumer in this state. I mean, that's what we're talking about today. The Live Healthy initiative not only allows us to continue to offer innovative delivery models like hospital at home, but it also incentivizes more innovation and new technology solutions. And Live Healthy breaks down barriers so more people can access the care they need. Importantly, Live Healthy makes strategic investments in our healthcare workforce so we have educated and trained professionals to meet the growing demand of care. With Live Healthy initiatives, Florida will be a model for the nation in delivering world-class health care. Thank you, Governor DeSantis, President Passidomo, and Speaker Renner for advancing this important legislation. Tampa General Hospital is proud to be a part of this effort. Thank you very much.
All right, well, we'll guys, if anyone want to gather around, we'll make this official right now. Go through all this. See how we can get that one side.
Yeah.
All right. So, first one, Senate Bill 1758. Today is the 21st. There's one down. All right. Second one, behavioral health teaching hospitals. All right, that's two down, three to go. I guess, is this the biggest one, SB 7, yeah. 7016.
They're all there. They're all very short. It's just longer.
All right, so we've got that one. And healthcare innovation, SB 7018.
That's a very important one.
We got that. And then more administratively, this public records. That one real quick. All right, so now I'm going to hand out. All right, you guys want pens? Any other kids want pens? Do you have any out there? Children? Thank you. Here. Now, the real ones. You get one. Colleen. Yeah. There you go. There you go. Anybody else? Okay. Here we go. There we go. Anyone else? Okay.
I'll take a picture.
Yeah. Okay. Oh, okay. I got rid of all the kid ones. I'm sorry. Well, we got more coming. All right, I got one more for the adults. All right, we'll bring one over there. Okay. Can we get one over here too? Another pen. Who wants this one? All right. Now, can you guys just help and hold those up? Can you hold that up? Can you guys help hold that up? All right. And voila, there we go. Yeah. Okay, appreciate it.
Life is good.
All right, thanks so much. Congratulations. Good job. Hey, how you doing?
Thank you.
You did it. I usually don't take a pen. This is for Allie.
Well deserved.
Well, she wrote it down there.
Okay, good deal. Thank you.
Thank you so much.
Thank you.
Oh, yeah.
For sure. For sure. So that's a lot of work that's been put into that. So congratulations to everyone that was involved. I know Kathleen worked hard on it. I know a lot of people in the House and Senate worked hard on it. And we've got much more coming down the pike over the next weeks and months. Legislatively, there's a lot of really good stuff. Yesterday, I just signed a first of its kind in the nation bill to not allow any sleeping or homeless camps on sidewalk, streets, or public parks in the state of Florida. We're not going to turn it into San Francisco. We're going to make sure that we have high quality of life. We've done a slew of bills to make sure that we're not allowing illegal immigration into Florida. And so we've got great bills that we signed into law there. We're going to do some education. We're going to do bills relating to parents' rights. We've got a lot of stuff in the hopper, which is going to be very exciting. And then, of course, the budget. We're starting to go through the budget and getting all that in order one way or another. And so, so that'll all come in for a landing. But I think what you'll see is that you're not going to find a state in this country that is governed more effectively than the state of Florida is. And you'll... And part of that is, of course, working with the legislature to generate good policy, make sure we have a good budget. We're going to keep paying down debt. We're going to run surpluses, cut taxes, all that stuff. But then part of it also means getting the job done when you need to in other areas. And so, for example, when the Hamas-Israel war broke out on October 7th, we knew there were Floridians stuck over there, so we engineered flights to be able to bring people back and rescue and bring to Florida, which, you know, was not the easiest thing in the world because it's halfway around the globe and all this other stuff, but we had a friendly government and this and that. Now, with what's happened in Haiti, there are a lot of Floridians who were stuck there. Now, not as many as that were in Israel, perhaps, but these are folks that are doing work in Haiti, missionary work, other types of work, trying to help people. I mean, clearly, the country's had problems for a long time. It's gotten worse, but it's just, that's what they've dedicated their lives to doing. They're now in a situation. So we have now started to bring people back from Haiti safely back to the state of Florida. So we're going to continue to do that. There are definitely more people in the hopper that are going to need help. I will say that we don't necessarily have the same cooperation on the ground with the Haitian authorities that we did with the Israeli authorities, and so that's made it more challenging. It's also much more dangerous in the sense that just getting people out of places like Port-au-Prince can be dicey. So, but we're putting significant resources in, and we were able to have the first flight take off yesterday. We expect more to be able to come. There's been issues dealing with the bureaucracy with the federal government because, you know, we're not just flying by the seat of our pants here. I mean, we're bringing in people that are vetted to be able to be either Florida residents, U.S. citizens. I mean, they've got to qualify, and so we're doing it the right way. And the bureaucratic hurdles have been significant. It is the case. I said this morning, but it's the case. Unfortunately, it's easier to get into this country illegally than it is to bring back an American citizen from a war-torn country. And that's just the reality. So it's sad that that's the case, but we're going to continue to stay in that fight, and we think it's very important. But what we've also done is, as we're rescuing Floridians from Haiti, we also understand that the state of Florida is not going to have massive numbers of boats landing into our state. And so the Coast Guard, his job is to protect the coast. They don't have enough resources. We've had vessels helping them for quite some time. In January of 2023, I did an executive order. We surged more resources. And since January of 2023, just the state of Florida authorities have interdicted over 660 boats, leading to the repatriation of almost 14,000 would-be illegal aliens. And so that's just from the state. It's not even counting what the Coast Guard has done, which is also significant. In light of what's happened over the last few weeks, we've put even more resources out to be able to protect the coastlines here in the state of Florida. And I think it's the case that if you look, if people know that what's going to happen if they try is they're going to get stopped and sent back, fewer are going to try to do it. So we actually haven't seen an uptick in the number of vessels coming in. There has not been a major surge. We always have onesie, twosies people try to go. But that's just where we're at with that. But we're in that fight as well, and we're going to make sure that we're protecting our shorelines and protecting our communities. I mean, Biden is obviously he's got the border issue, which has been a total disaster, but they're doing more than just having an open border. They're actually going to places like Haiti and just flying people into our country, bypassing the border. So you had one Haitian they dumped in New Jersey or New York, ended up in Massachusetts, and now is facing charges of raping a 15-year-old girl. And you're just thinking to yourself, why is he importing that into this country? So we're doing more than any state has ever done to be able to protect our borders here in Florida. And we're happy to do that, and we're going to continue to do that. So I just want to thank everyone that's been involved in it. All right, we got any questions back there? Yep.
Governor, your thoughts would be given on Tuesday's low voter turnout, and now that the primary is over, do you plan to go on the road and campaign?
I don't have anything to add before. I addressed it yesterday, so people can kind of look back at that. I think the one thing I would reiterate from my comments yesterday is the Democratic Party decided to cancel their presidential primary. I think they were trying to run interference for Biden, and what that led to was a collapse in turnout for them. And so, yes, people could say Republican turnout was lower, but that led Republicans to sweep a lot of these local races in places like Delray Beach and in Broward County. And so I think it was a dumb decision that they made to cancel that. They lost elections in part as a result of that. And I think that that's kind of been par for the course. When I became governor, a lot of people thought Florida was going to end up a blue state. They thought that was the trend. Most of these elections statewide had been 1-point races or less. I came in a similar fashion. We had 300,000, close to 300,000 more registered Democrats than Republicans in 2018 when I got elected. By the time I ran for re-election, we had 300,000 more registered Republicans than Democrats. And so that was a big change that we saw from almost 300,000 in the hole to 300,000 plus, 500,000 plus shift towards ours, and that we ended up winning by 20 points, including winning big in Southwest Florida. But since that election, Republicans have netted another 550,000. So it's about 850,000 more registered Republicans and Democrats in the state of Florida. And I think it's just a reflection that people are gravitating towards successful policies. I mean, you look at what they're doing in these other states. People are fleeing these areas. I mean, the homelessness bill is a great example of that. San Francisco, L.A., New York, they have policies that incentivize people to camp out on sidewalks and in parks. There's drug use. There's crime. You can't even go for a walk to walk your dog in peace in some of these areas. Forget about taking small children to a park. They've totally collapsed the quality of life. And what we've said is, no, we're not going to do that. We're not going to allow camping in parks, on sidewalks, in front of somebody's businesses or any of that. So you as a Floridian, you have a right to walk down the sidewalk in peace. You have the right to walk your dog at a dog park. You have a right to take your kids out in public doing this without having it. And I know, look, is that going to be a big issue in Bonita Springs compared to some other parts of the state? Maybe it wouldn't be as big here. I get that. But we are not going to allow any of those local jurisdictions to mimic a San Francisco or New York. Same thing with standing for law enforcement. We back the people that wear the uniform. We provide bonuses for new officers. We've done $1,000 bonuses 3 years in a row. We have strong policies to deter crime and to punish people that commit it. That's different from what you're seeing in these other areas. Other areas are raising taxes on people. They have bad budgets, they waste a lot of money, and they keep going back into your pocket. In Florida, we've cut taxes by record amounts since I've been governor, and the last 2 years combined is over $4 billion in tax relief, which is by far the most we've ever done over a 2-year period. And education, making sure that everybody has an ability to parents have an ability to choose the school of their choice, regardless of income level. We now have close to 400,000 kids on scholarship, 400,000 kids in charter schools, a lot of school choice within school districts, and we're ranked number 3 in the country for 4th grade reading, 4th grade math in the most recent NAEP results. So people see that. They see us supporting the rights of parents to direct the education and upbringing, to be involved in knowing what curriculum's being taught. So that ultimately is, I think, what drives it. And I think the Democrats here, they're catering to kind of the woke left. And that's a dead end in the state of Florida. You are going nowhere fast when that's your platform.
Yeah.
Yep. Anybody else back there? All right. Oh, yes, ma'am. It's criminalizing that's not criminalizing homelessness. What they're saying is you don't have a right to just sleep in front of somebody's business, or you don't have a right to just take over a street and put an encampment down. You have homeless shelters. What the bill does is it says you have a right to take people out of the public areas and put them in a shelter. We're putting requirements that you're not allowing them to use drugs. You're offering mental health. You're doing that. But that's what it does. They should be in a shelter. They should be someplace that is outside of where the public is impacted by this. You should not be impacted by a homeless encampment as a Floridian. That's what that bill does. And you know what? If other places around the country had done that, there probably would be a lot fewer people moving to Florida as a result. Thanks. Thanks, guys.